Thank you for coming this evening. As I explained, my name's Fran. I am a GP in North Sheffield, and I set up a FeNO testing clinic across our PCN for improving asthma diagnosis and management. And this is just a bit about what I did. So my PCN is called SAPA 5. It is made up of 6 different practices across a very deprived area of North Sheffield. PCS is a federation, I think they are, which stands for Primary Care Sheffield, and they provide all of our out of hours hub appointments and kind of nurse, GP, physio. They provide some kind of community contraception clinics, those kind of things. But the reason we partner with them is because we ran the clinic in the out of hours hub with them providing that. And then Health Innovation Yorkshire and Humber were involved from the off-go, and they basically help with project management support. So we had regular meetings with them. I was kind of running the project from a clinical side, and I'll explain kind of what I did. But they helped kind of keep it on track. And then now that we've finished our year's worth of data collection, they've helped with the analysis and write up, and we've submitted it to some conferences, which they've helped with kind of the creation of the abstracts for. So that's kind of who's been involved. So tonight I'm just going to have a quick chat about FeNO and what it is, how we set up the clinic, money, the data we got from the year, its first year of running, and the kind of conclusions we can draw from that. So you know, studies have shown that asthma is underdiagnosed, and there's a variety of figures bandied about, but one kind of large meta-analysis said about 50% of cases is undiagnosed. As I say, that percentage is debatable, but looking at different studies, the average of different studies, and we know that the burden of respiratory diseases is disproportionately higher in deprived communities due to a variety of reasons, all of the kind of normal health inequalities reasons, but also the kind of exposure to air pollution and other pollutants in the more deprived areas where people are living, along with housing and other kind of health literacy levels, can all contribute to that higher burden. We also know, someone mentioned in the intros about the environmental impact of poorly controlled asthma and the over-reliance on the shorter acting beta agonist inhalers. We know that the biggest part of the carbon footprint of general practice is prescribing, and within prescribing, inhaler prescribing is the biggest component of that. So you know, improving asthma care, the main priority is improving, obviously, patient care, but one of the positive byproducts is kind of reducing the environmental impact of general practice. So in 2024, BTS and NICE and SIGN all joined up and produced a joint guidance, about the whole of asthma. And one tiny little bit of it was about the diagnosis, which was really helpful because previously it was a bit grey and it was a bit kind of, oh, you could try some treatment, oh, you could maybe try some spirometry. Oh, for children, it was mostly just refer. But this was quite descriptive in the guidance as to how to diagnose asthma. So these are the guidances here. So for adults, it's a blood test or a FeNO level. And then you can diagnose asthma if the eosinophils are at a certain amount or the FeNO is raised. And then for children, it's just a FeNO with a suggestive history, and that can be diagnostic in the case of children. It did say if FeNO is not available, then you can look at kind of peak flows and spirometry and referrals, but these were kind of the first line investigations suggested. And I think this is one of the things that prompted the clinic, because it got me thinking, well, how do you get a FeNO test? I mean, at the time I didn't know what a FeNO test was, but I soon learned. So this is the PCN. So PCN is a primary care network, which is a group of neighbouring practices all across the UK, or definitely in England. These are in existence. Our particular PCN has 6 GP practices in it, and within the 6 practices there were 3 who used this clinic. That was because 2 of the practices already had their own FeNO machines, and then a third one did start using it, but it was kind of towards the end of the year's worth of analysis. So we just excluded their data from it because it would kind of confuse things. The whole PCN practice population is about 38,500 patients, but within the 3 practices user clinic was about 25,000-ish patients. And all of the practices are in the most deprived decile of socioeconomic deprivation. So really kind of at the raw end of the health inequalities scale. So FeNO, just to recap what it is a little handheld machine with a mouthpiece that you breathe into. I think you have to keep breathing out for something like, I mean, the nurses on this call will know better than me, a short amount of time, 5, 7, 10 seconds or something like that. And it measures nitric oxide in the breath, which is increased if there's inflammation in the lungs. So I inquired about how we could get a FeNO machine, and then at our practice, our kind of nursing and nurse associate and HCA appointments are all very fully booked for weeks at a time. But in our out of hours clinics run by the PCN, they're often not booked. So there's nursing associates, HCAs and nurses who all have unused appointments. So I approached the PCS Primary Care Sheffield who run the clinics and said, look, could we train them to be able to do the FeNO test and then use those appointments. They were absolutely happy with that and actually used as a bit of a test PCN, and hopefully are going to roll it out across some other ones. So the thoughts were that it's a bit like sending a patient for a blood test. So the patient sees the clinician with possible asthma symptoms, the clinician books an appointment for the test, the patient attends for the test and then leaves. So the clinician doing the testing isn't there to interpret the results. So very much like a blood test, you turn up, you have your blood test, you go, and you go back and see your doctor or nurse for the results. So that was the setup. The nursing associate and HCA in the clinic did online e-learning to learn about the FeNO machine, and then one of the nurses gave a face-to-face training session, and that was adequate in terms of training for them. And then the nursing team in our practice, I'm assuming it's the same in the other 2 practices, also completed them training on interpreting FeNO results so that they could then receive the results and see the patients with to explain the results and next steps. So that was the kind of process that was set up. Obviously, I had to write a SOP, which I didn't even know what that stands for, but that's a standard operating procedure for all of these things. So I've got one for the PCN and one for the PCS who run the out of hours clinic, obviously to have everything documented and in place. At the time, these were the costs. So I think we got the machine in December 2024, and this was the one that was chosen. It is actually a brand that you can only test children from age 7 and upwards. I think some can go from 5, but for whatever reason this was chosen. And then there's the cost of ongoing mouthpieces. So we did the analysis for a year, and as you'll see in a minute, there was 218 tests. So probably ordered 5 lots of those mouthpieces. So in terms of cost, there was no additional cost for the running of the service. There was no costs involved in the staffing because we used existing unused appointments within the out of hours clinic. So it was just those costs which the PCN were happy to put forward. So we looked at all the data from January to December last year, and throughout that 12 months, there were 218 patients seen in the clinic. There were 62 children and 156 adults. And just over half had a change in medication after testing. So these are some of the slides that the Health Innovation Yorkshire and Humber are specific looking at children and young people, which is what CYP stands for. So their kind of funding and proposal for this kind of project was specifically regarding asthma in children and young people. So that's why those numbers are pulled out. This, the change of inhalers could be going from none to some, or change of type of inhaler after testing. So these are patients who were on no inhalers at all or SABA only inhalers. So as per the guidance, nobody with asthma should just be on a SABA inhaler. Everybody should have an inhaled corticosteroid inhaler, preferably a dry powder combination inhaler as a first line. A number of patients were not on that, and those who were only on SABA or on no medication, out of them, 85% of them got changed onto an inhaled corticosteroid. Out of the 6 patients who didn't, 4 did not attend for their follow-ups. One was a child who I think he slipped through the net first and he was under 7 or something, so then had to be retested. And I can't remember what the 6th one was. But it just goes to show that basically everyone who had the test who was on kind of non-guidance based treatment and had follow-up was changed to inhaled corticosteroid inhalers after they had their FeNO testing done. So yeah, that's kind of just what I was saying there. We also looked at referrals to our secondary care paediatric services, and I'll get the numbers up after this, but they decreased by 35%. So compared to 2024, I can't remember the exact numbers, but yeah, there was a definite reduction in referrals from the practices in our PCN, which we actually looked at all 6 practices. So that could have skewed things a little bit. So hopefully the 3 that we're using the FeNO did reduce referrals even more than that. So we were really pleased with this. We felt that this really showed how FeNO testing can improve diagnostic accuracy and improve kind of guideline-based treatment and beneficial treatment for the patients, and also reduce referrals. We felt that overall embedding the FeNO testing within a GP service meant that it was easily accessible. So where we are based in Sheffield, the Sheffield Children's Hospital that we refer to is the other end of town, and transport is a big barrier for parents to get children there. So having a quick, easy test on an evening at a local GP surgery is far preferable. Overall, the cost is not high. A couple of £1,000s to a PCN I didn't get any pushback. That was a big ask. There was no issues with that small amount of spend. The evidence we've gathered showed that has improved diagnostic accuracy and starting patients on evidence-based treatment. It facilitated the appropriate initiation of ICS therapy and reduced patients who were on SABA-only treatment, and it reduced referrals to secondary care in children. We did not look at referrals in adults because we had a paediatric respiratory consultant working with us and not a adults respiratory consultant. So the paediatric respiratory consultant could provide the data for us, but that's the only reason we don't have that data for adults. Those are just the references, and then I was asked afterwards if there's any feedback on this. That's the QR code to give any feedback. But I will shut that down now and stop sharing my screen. Does anyone have any questions or thoughts or anything they wanted to add about any of that? Super. I've wowed you all into silence. The one thing I was going to say is, I think it was Mina mentioned about getting it where you are, and you mentioned about inhalers and nebs. So before FeNO testing's done, so inhalers and nebs are usually used for spirometry. So patient, I mean, please, some of the nurses on this correct me because you'll be far more knowledgeable than me because I don't do spirometry, but they have an inhaler and do the test and then have to have an inhaler and do whatever. Whereas this, you don't have any, it's not, there's no inhalers or nebs involved in FeNO testing. You literally turn up and leave. That's the whole test. I was chatting to one of our nurses today about this because I have literally seen a patient today who I thought might have asthma, and it's what to do. So our appointments are currently 2 weeks away for the FeNO testing. What do you do in those 2 weeks? Do you give them an inhaler? Can that affect the result, etc.? So we actually send the patients an Accurix text with what to do and not to do before the testing appointments, because there's a couple of foods that they shouldn't eat in the 3 hours before, and don't ask me what they are off the top of my head. And inhalers wise, it's fine if they have SABA. I think if you give an oral steroids, you should wait a certain amount of time before FeNO testing. And if they give an inhaled corticosteroid, the nurse was saying she tells them to stop it a couple of days before the FeNO test, because obviously that anti-inflammatory effect of the inhaled corticosteroids could affect the FeNO result. So in terms of what to do, I think if the patient can like the patient I saw today, I just gave them a salbutamol inhaler to use for the next 2 weeks as and when, and then she's having a FeNO test, and then she's seeing me, and then I'll put her on a combined dry powder inhaler. So yeah, does that make sense? So I don't know if what you were talking about is the spirometry testing with the inhalers and
So
nebs,
I
and I'm
was trying to
sure people on here could comment more better on that than me.
figure out, like, I'm not familiar with diagnosis of asthma, obviously, hence joining the call. Can you just do FeNO testing? Is it because that not many practice or, outpatient has the FeNO testing machine, therefore they opted for spirometry, therefore there's loads of single-use inhalers. So to diagnose asthma, obviously, and obviously Spiro is a COPD diagnosis as well.
Mm,
So to rule
mm,
out either. But if you purely like suspect asthma, can you just do FeNO and
mm.
avoid
Yeah,
Spiro?
yeah.
Okay.
So I
Okay.
think historically, like before COVID, we ran spirometry clinics at our practice, and then obviously that all got stopped in COVID, and then it restarted again fairly, I don't know, a couple of years ago. Whereas this FeNO's new. I mean, it came into this guidance without any, without any, what's the word? Facilities in place and any kind of things in place. But FeNO is so much. I mean, we put them into like 15-minute appointments. Spiro is like 30 minutes plus, isn't it? With all those things that you say, Mina. So yeah, if you're suspecting asthma, the current guidance is to do a FeNO test if that's available, and if it's not available, then spirometry. Um, and obviously, FeNO can be done by any level of clinician. So spirometry, I think, is generally just done by the nurses. Again, please correct me if I'm wrong, but the FeNO testing is a fairly easy test for any person, any clinician to be able to do. You just say breathe into this, and then you read the number off the machine. So
Bruno, thank you. I think when
yeah.
we met up with the subgroup of the IPC Society, we were debating whether we can reuse inhaler, like wipe the inhaler
Oh, I
clean using
see.
spacer, and whether use NEBS
Mm.
testing for Spiro. But then none of us mentioned like FeNO as an alternative to the
Yeah,
diagnosis. And why do you have to go through the spirometry route? So
yeah,
this is great to bring back to the team.
yeah,
Thank you.
super. I mean, it's cheaper and easier and less environmental impact and quicker and everything else.
Thank you.
Thank you. Thanks, Mina. Did someone have their hand up? I'm sorry, I wasn't really on it.
Yeah,
Um,
sorry, friend, it's just me, rather.
no,
I
no.
just had a question. Like,
Mm,
in the pediatrics population, what are the biggest barrier? Like, what are the challenges? Because they're very young. Are they able to do the techniques and cooperation? How are things?
yeah,
Because it would
totally
be,
fine.
yeah, because in terms of the spirometry, I know that they have huge issues, but with
Mm.
the FeNO testing, how have you guys found in your area?
Fine. I think one of the Mofino machines, when I was looking into it, has a bubble and you have to blow the bubble, or you're like a fish or something that has to blow a bubble. They literally have to breathe. I think it's, I mean, is anyone doing this? Some of the nurses on here, if they're doing it, I've not had any reports of any children who cannot do it. And we are doing over 7-year-olds, but they have to, like the peak flow tubes. I think they're a bit like that. And they literally put their mouth in and blow the bubble on the little screen. Is it 7 seconds? And that's it. And then it comes up with a number. So it's sorry, Kirsty looks like she's come off. Are you going to say something smart about?
Yeah, no, so it's 12 seconds for
Oh
adults and 10 seconds for
10
kids.
seconds.
And I would say kids are better than adults.
Mhm.
my.
The odd kid can't manage it, but after the second attempt, they're usually fine.
Okay, that's good to know. Thank you.
It feels like it's much more accessible for children as well as the feedback we've had, in terms of, I don't know, the nurse, the staff has said it's not, I don't know, spirometry, don't you have to get them to kind of breathe in a certain way, and then they have to have an inhaler and then to breathe again, and it's just all quite faffy. And then so the children just kind of, yeah, seem to get it quite easily. We've certainly,
Okay.
yeah, had no reports of any issues.
Oh, thank you.
No problem. I was just going to have a quick look at the children think it's a game. Yeah, everything's a game to kids, isn't it? I was just having a quick look in the because I've got all the breakdown of all the results. So in the children and young people group, 26% were high scoring, which is I did have it on the start as what it is. I think that's kind of over 50, and then 69% were in that 35 to 50 zone. And the other thing I was going to have a quick look at is the referral rates. Adult, that's adult, no shows. Here we go. So, yeah, there were 40 referrals in 2024 and 26 So yeah, sorry, 17 referrals in 2024 who were age 7 and over, and 8 referrals in 2025. So the year before we did it, there were 17 children referred to paediatric services from our PCN, and in 2025 there are only 8 of them. So I mean, I'm not a statistician and all of that jazz, but it sounds pretty good to me. Yeah, does anyone else have any questions or anything else they wanted to ask about it all, or anything they've tried in their practices or areas of work? Yeah, Anitha.
So in my practice, they are starting this FeNO very soon, as Radha said, and they are expecting me to interpret it. So what sort of resources and courses am I supposed to,
Say
seek?
again, sorry, I missed that.
What sort of, courses would you recommend? Like, they have booked me for a spirometry course. Is there anything else, like you mentioned about resources and things like that?
So the staff who did the testing, so there was a nurse associate and a HCA, did like an online e-learning. I feel like it was on that e-learning for health, actually. The GPs who are interpreting it have done no training, but basically the NICE says if it's over 50, it's a positive result. So
That's all, is it?
that's
Okay.
it. That's it. I can't speak for the nursing staff in our practice, but I don't know if they did additional training or if they just say, yes, your result is over 50 and so you have asthma. I think possibly the kind of maybe who are like 40 to 50 range, if there's kind of ambiguity, they might seek further testing. But as far as I'm aware, I don't think a huge amount of training is needed to interpret the results if you're a
It's
GP or a
straightforward,
nurse.
isn't it?
Yeah, exactly.
Okay.
Just follow the guidance. Though, as I say, there was training put in place for those doing the test in terms of advising the patient how to do the breathing correctly. And I think they do a little checklist before in terms of making sure they haven't eaten the foods or whatever it is they're not supposed to have eaten and making sure they're well that day, kind of thing. But I mean, it's just a little checklist I think they do. Yeah, so I mean, I'm interpreting FeNO and I've had no additional training in it. I just follow what it says on NICE. I guess
got it
depends
actually
on.
in 2 days, so I don't know what I'm
Oh,
looking at.
yeah. So I guess it depends on
I
clinician confidence in terms of
yeah,
being
means
able to
I
interpret
had
that.
no idea about I haven't actually seen the machine yet. But
Yes.
now I was looking at the email. It looked like a spirometry course. I don't know whether both are
Oh
involved
no.
in it. I've got no idea what I'm doing. Let
That'll
me
be a
see.
fun surprise. See when you turn up.
All right. Thank you very much.
No problem. Linda, did you have a question?
Well, it was just really following on from that. The e-learning for health, they do have two modules. It says they take 30 minutes each, I think it said they take, but they don't take that long to do, and that gives you quite a good insight into both, actually doing this, I was going to say spirometry, and doing the FeNO, and interpreting it, and gives you some sort of guidelines as well with regards to the information to be, either sending to the patients beforehand, or to check before you do the test. So yeah, e-learning for health, that's what I'm going to look to